Hello, my name's Kai Mitchell, and I've been asked by Sensei Kojima to give a few words about muscle energy technique, Mitchell muscle energy technique for the Japanese community. As many of you know, or may know, muscle energy was originally started by my grandfather, and later further developed by my father, and now I'm third generation practitioner. Muscle energy has really been played a significant role in the development and advancement of osteopathic principles and practice. It brought to the practice of osteopathy the role of biomechanics, specifically into the mindset of understanding how somatic dysfunction works. Originally, muscle energy technique was developed to treat the biomechanical lesions that my grandfather had discovered as pertains to the pelvis and sacrum. Before my grandfather's biomechanical model of the pelvis and sacrum, there was not much consideration for pelvic or sacral motion, and many in the medical community thought it was actually either relatively fused, or if there was motion, it was only a degree or two between flexion and extension. With his research, he understood that there are many more dynamic motions available in the pelvis and sacrum, but none of the current treatment modalities really were sufficient to treat the lesions that he discovered in his research. And so he developed muscle energy technique, which involved patient effort activation in a very controlled and specific way to affect restoration of function and motion in that area. It was really a breakthrough, and really was the beginning of a vanguard in osteopathic thought. And by that I mean it was the first time really that biomechanical principles were really applied in the context of OMT. And that was a radical breakthrough. Prior to that, somatic dysfunctions or restrictions in the spine, etc., were not really quantified and measured in biomechanical terms, but more in terms of restriction or a bone being out of place, in effect. And so with this new theory of muscle energy technique, it really made the understanding of somatic dysfunction a much more dynamic model, and it helped to better understand how it played in with other systems within the body. With this change, and kind of bringing more scientific principles also to the practice of osteopathy, came a whole new language to describe these elements. And in fact, if you look at the glossary of osteopathic terminology, the majority, more than anybody else, the majority of those terms refer to work that was derived by my grandfather or father. And that's a significant contribution, because it brought a whole language to describe somatic dysfunction in terms that were not vague or subjective, but actually rationally and objectively based. So that really created a whole new attitude and direction of thought in terms of osteopathic practices, and really brought it to the 20th century. So, and 21st century. So with that, since it was originally developed, muscle energy has gone through many evolutions, and it's really been developed as a very comprehensive system for treating dysfunctions. Many places in the world purport to teach muscle energy technique, but really a lot of that is very different from what the Mitchell model presents. And mind you, we've been developing this continuously in our family for 3 generations. And it's been about, probably close to 80 years of development within the family. So with that comes a whole new understanding and refinements in terms of not only the technique, but the understanding of the underlying theory behind muscle energy technique. And there's a lot of different versions of it out there, but a lot of it miss the great potential that muscle energy has. One of which is that it is not just a way to treat specific somatic dysfunctions, but the way it's presented with the Mitchell method is that it looks at the body and gives you an ability to assess and do physical diagnosis for the whole musculoskeletal system and effectively address and treat every joint. But there's a method to it, and you have to do things in the right sequence and apply the right protocols in the right sequence in order to really fully realize it as a comprehensive system. Once you understand that, there's no part of the body that you haven't looked at or taken account of in terms of understanding what that particular individual needs to restore function and health in their body. And so Muscle Energy has done a great service in that regard, not just for the osteopathic community, but for the patients who receive it. Because a lot of times, unfortunately, there isn't enough attention given to the physical diagnosis part, and there's kind of a tendency, unfortunately, for practitioners to chase symptoms or to try to get a patient's condition to conform to the technique that they know, the treatment techniques they do know, instead of treating what the patient is actually presenting with. And so Muscle Energy provides very objective standards for evaluating the whole body, and doing so in a way that gives you concrete information, is not subjectively based, and gives you a chance to measure concrete outcomes from the treatment. And so if you consider that basically with Muscle Energy we can address joint dysfunction in pretty much the vast majority of the joints in the body, we can address muscle imbalances and dyskinesias, postural issues, mechanical gait issues. Of a special importance is restoring respiratory functions in the body, and just also reorganizing and improving proprioceptive and core muscle function. And so there's really no other modalities that are as comprehensive in their effect and ability to assess and treat the musculoskeletal system. And so in that regard, with Muscle Energy technique, you're also more than likely addressing the cause of the somatic dysfunction and not treating the symptom. So I encourage people, if it's not part of your toolbox, I encourage you not only to get some training in Muscle Energy technique, but in particular, learn it from somebody who's advanced and certified in Mitchell Muscle Energy technique, because that's really the best form of and practice of Muscle Energy technique that's out there. And with it, it'll really advance your ability to see good results in helping your patients. So hopefully we're looking at the possibility of setting up a teaching clinic in Tokyo in the not too distant future, and if we do, we hope to see you there and hope you can join us for the next available course. Thank you.